Technique of Urethroscopy for diagnosis. Anterior urethra. The patient may lie on his back, though it is usually wiser to precede or follow the examination of the anterior urethra by that of the posterior. And for this, it is more convenient to have the patient in the usual cystoscopy position. No anesthesia is required. The tube is lubricated, the glans penis cleaned, the tube introduced, directed downward until it will go no further. Then it is gradually inclined to an angle of 60 degrees or more. The operator then steadies the tube with his left hand, the forearm steadying itself against the patient's body. The obturator is then removed with a gentle rotary movement to disturb the tube as little as possible. The source of illumination is then affixed, and one looks for the orifice of the membranous urethra. Usually the tube has not been bent over far enough. One sees only the floor of the bulb. By rotating the tube still further downward, the puckered lumen comes into view. Then the tube is slowly withdrawn at such an angle as to keep the lumen of the canal in the center of the field of vision. The tube is slowly withdrawn, all parts of the canal being inspected as they pass under the eye. Blood, pus, or lubricant is mopped away with a cotton swab or on a wooden applicator. Normal anterior urethra. The walls of the urethra fall together over the end of the tube to make a hollow cone. The mucous membrane varies in color from pale to salmon pink. The absence of inflammation is evinced by the suppleness of the walls of the canal, which fall together in longitudinal folds from 4 to 12 in number, radiating from the center to the circumference of the field. Between these folds, the pink mucosa is lined by longitudinal deep red striae. Upon the roof of the urethra, and less frequently upon its floor, the crypts of the Morgagni appear as deep red indentations. The normal ducts of Latreille's glands are invisible. In the bulb, the lumen of the urethra forms a lateral slit. Openings of Cowper's ducts upon the floor of the bulb are usually concealed by a fold of mucous membrane. The navicular urethra is pale and rigid. The lumen is a vertical slit. There are no folds or striae. The opening of the lacuna magna is seen upon the roof. The inflamed anterior urethra. When subacutely inflamed, footnote, acute urethritis absolutely contraindicates urethroscopy. The surface is red and velvety. The gloss and the brilliant red striae are lost. The swelling of the mucous membrane reduces the number of longitudinal folds. Patulous crypt orifices are seen exuding pus. Mild chronic anterior urethritis, soft infiltration, shows much the same picture. The redness is not so marked. The luster of the surface may be increased, but the striae are lost, the folds reduced, the crypts red, patulous, purulent, or cystic. Severe chronic anterior urethritis, hard infiltration, in which the inflammatory exudate has been largely converted into scar tissue, shows a gray, eroded, lusterless surface with no striae, few or no folds. The ducts of Latreille's glands may project as minute, vivid red points in the midst of a mass of congestion, glandular type, or these red spots may be absent, dry type. Sclerotic white patches or stellate white scars may appear here and there.